the reason why that's so hard and leads to disastrous outcomes is not because people don't identify their own pain or their own issues. It's because they're not believed in the system, especially when they're being reported by women of color, but also by women and by people who are outside the gender binary. They're just not believed in the system. They're just not seen as credible. And we need advocates who first start with believing us, right? In order to get the help that we need. And these folks are the practitioners who do that work.
So to kick it off, Indra, maybe I'll start with you and then anybody else can jump in. What is the birth equity bill package and why is it needed?
It's a set of bills that collectively cover over 24 different policy areas that we think will start to address inequities in birth outcomes. It's needed because of those inequities, but it's also needed because care that everyone receives in the United States during the perinatal period is inadequate and subpar. We have some of the worst quality of care at the highest cost in the world. We're paying more and getting less than people in other countries. And so when there are disparities, I think it also, it really emphasizes how poor the poorest care is in this country because it's subpar for our best outcomes. And when there's a disparity, especially based on race, that's, inequitable, that means, there's really a profound gap and we can do better.
And I'd like to add that the bills in particular move theory to action, which is really important. Structures and institutions have the evidence. The evidence is widely available. And so when we review current recommendations and current literature, oftentimes we, in theory, recognize the shortfalls and the poor outcomes. However, we, as a community, there are very few leaders who will actually take and move those theories into a legislative process. And that's exactly what these bills did.
I would just add that the bills set a standard of care. They also set a standard of accountability for a healthcare system. And on top of that, and one of the things that I think is most important about these bills is that it's responsive to community needs. Indra spoke to it a little bit, but over the years, I've been in Colorado for 6 years, and many of the people on this panel have been here much longer than I have. But when I entered into the birth worker field here in Colorado, communities were very loud and very clear about their experiences. And I think that this bill package finally addresses many aspects of what they were asking for.
And the thing that I think is the beauty of this package is that not only does it change points in the system that need to change that will lead to better outcomes for everyone, it also expands the system so that if you choose not to give birth in a traditional way, or you are in an untraditional setting, that you're still going to have good health outcomes and that there still will be accountability there, which I think is important. Including doulas and midwives into the process is very important, giving them the respect, right, and the accountability that they need to serve women is extremely important. And quite frankly, it's a direction that more women of color are going in right now because of the disastrous outcomes in the traditional healthcare setting. And these bills really bring those different ideas and worlds together in a way that I think will truly be transformative, or at least begin on the process of transformation so that we can change those health outcomes, not only in Colorado, but across the country.
I think for me as a practitioner, it was important to close the loopholes, particularly being an out-of-hospital midwife. Oftentimes having to navigate those structures and systems is quite complex. And in an emergency situation, time is of the essence. And needing to navigate is something that I shouldn't have to do, not when there are lives on the line. And so these bills help to ensure that when those instances do occur, that those intersections will be met with less resistance and trauma. And I think that's really important.
So I'd love to pivot and hear a little bit about that, listening to the community work that you all had done and kind of the roles that each of you had kind of played in that. Indra, I know when we had talked, you mentioned that comes off of kind of decades of like listening, deep listening to community. Would love to hear, kind of each of you talk about like what was that process like, and what was your role kind of in that process, and how that then transformed into kind of what went into the birth equity bills.
I have this in front of me. So this is the Diverse Colorado Voices report. And our friend Shelby Irvin, who was a huge leader in this report, is on the cover, who's also in El Paso County with Demetra. And we were able to hear from 77 birth equity leaders around the state, the majority of them being birth workers out of the hospital system, but perinatal professionals and or parents, and majority of them were BIPOC Coloradans. And so we asked them what were the biggest issues and what are the best solutions to issues that we see in the perinatal time period or in infant and maternal care. And the top 3 issue buckets were, number 1 was systemic racism. And so we heard, a lot of different stories of folks that had experienced explicit racism, and how that impacted their pregnancy and their postpartum up to 2 years. And then the second bucket was lack of postpartum supports, more predominantly lack of lactation supports and mental health supports. And then the third bucket was systems level inadequacies. That's when a lot of Coloradans talked about how we have, insurance policies that are very inequitable. They don't allow for folks to choose which provider they'd like to go with. They don't allow folks a lot of autonomy in the care that they receive.
Elephant Circle started in 2009. And that was even a few years after I knew personally that working in this field, which was barely even a field at the time, was my calling. And because it was a small nonprofit, I could really just grow it incrementally in response to what I was hearing from community. Of course, I was informed by my own experience as a queer person starting a family in Colorado. I was also deeply informed by somebody who's so deeply connected to this land and this region. I was able to really see imprinted here in this space the difference between how my great-grandmother, who gave birth 11 times in Colorado, before there was the kind of healthcare infrastructure we see today. But knowing that the kind of wisdom she brought to that experience was essentially replaced by this other system that we now see so clearly is a failed system.
That framework of conversation, as Indra referenced, comes from the perspective of working in community, being with community, and not just hearing their stories and wanting to amplify them, but again, moving those stories to a place where they could be heard. And just like Representative Harris mentioned earlier, BIPOC communities of color, and our non-binary folks are not heard, and not being heard. They are not being believed, and in not being believed, they are at an extraordinarily high risk of infant or maternal mortality. So having the ability to have conversations with community members, being able to make connections, which was a big part of my piece of the stakeholder process, was being able just to connect the dots, connect community with other organizations who were also working to bring this package forward, such as the surveys and the community engagement that Kayla is referencing too.
At the time that I entered the conversation, there were actually a lot of proposed legislation on the table for addressing maternal health. And to my understanding, many of those things didn't move forward because the community said, wait, we aren't a part of this process at all. How is it that these things can move forward without it being informed, truly informed by our lived experiences? And so with my role as a doula, I felt it very important to utilize the uniqueness of my role in having very close personal relationships and having had built trust with the families that I was working with to be an advocate for the things that they were communicating that they needed to be reflected in policy and legislation. And so a lot of my role was utilizing my voice to speak to some of the issues that I was gathering from their experiences, but also to help mobilize other Black doulas in our state to get involved with the process as well.
What advice do you have for people who might say, like, this is well, everybody's going to say this is incredible, but what do you advise to people that say, I hear this and now I'm inspired to go and do something. I want to do this in my state or in my community. What advice do you have for them?
Yeah, I'll start by just saying, seek out people who are already doing the work. Because undoubtedly there are folks in the community that are doing the work. There are doulas, there are midwives, there are elephant circles in a lot of our communities because the outcomes have been so bad. We have had to do something different, you know? And those professions I mentioned are really exploding. There are a lot of amazing, trained and supportive midwives and doulas that we need to lift up. And so I would say seek that out. And if it's not there, build a community of people who care about these issues, who look like the communities that are most impacted, and then move the work from there.
It is possible, and I think important, to do policy like this with community in the lead. So if you are in one of those agency positions or institutions, this is an opportunity for you to step back, to take a more listening position, to let community lead. And if you're part of community and you feel like it's insurmountable and overwhelming and daunting, let us be here to tell you that it's possible, that you can do this.
So when you're asking parents and birthing people and people of varying identities to show up fully in a way and to share their stories, sometimes those stories can be very traumatic and can bring up a lot of things for people. So ensuring that people are compensated for their time, ensuring that people have the resources in the interim to address their basic needs. Those types of things can really dignify the legislative process in a way that's absolutely necessary, and that was utilized in this process as well.